So we have two general symptom measures. We measure how depressed people are with the PHQ-9, and we have a general measure of anxiety, which I think many people will be familiar with, the GAD-7. If you look at the items on the GAD-7, it really covers how worried you are and how anxious you're feeling. And it is quite sensitive to improvement in all different anxiety disorders. It goes down as the anxiety disorder gets better. But it does have a limitation. And the limitation is that it doesn't have any specific items to do with PTSD, for example. It doesn't measure intrusive memories of painful events. It doesn't assess difficulties with social interactions, which is relevant to social anxiety. It doesn't assess obsessions and compulsions. And for panic disorder, it doesn't actually record panic attacks. So we've encouraged therapists in the services to use what we call anxiety disorder specific measures. One's particular for PTSD or panic, etc. And what you see on this slide is an analysis where we've compared the outcomes when your therapist is using the specific measure to help guide treatment versus when a therapist is not doing that. Of course, we have to be fair and use the same outcome metric each time. So the recovery rate is, are you below the clinical threshold on both the PHQ and the GAD? And you can see your therapist being aware of the key features of your problem that's being treated and using it to guide treatment makes an enormous difference to recovery rates, PTSD from 32% up to 53%, and the same sort of difference across the board of all these anxiety disorders. And it's not just symptomatic improvement. If we also measure how disabled someone feels by their mental health problem, and again, you get this big difference. So it's not just a matter of recording outcomes on a regular basis as you go through treatment, but it's about choosing a measure which helps the therapist to stay particularly focused on the key features of that problem.